Hey everyone, this is Hannah with the Rocket Miner giving you today's COVID-19 update. Today in Wyoming, we're up to 389 confirmed cases, 131 probable cases, and 343 recovered cases. The confirmed case count there went up 19 from yesterday. It was at 370, now it's 389. And just as I was looking at the numbers, I thought, oh, that's a bigger jump in numbers than we've seen the last few days. But then we remembered they're expanding testing now, so as they expand testing, we might see the numbers going up more. As a lot of health officials have told us this whole time, the limit in testing limited our numbers, and they were all pretty sure there were more cases out there than what we were able to confirm because of the limited testing resources. So as they're able to do more tests, we might see the numbers go up even more again. So it's always a good thing to keep in mind when you're looking at the numbers and thinking about the total amount of cases. With the news about the increased testing, today we had some good news that locally we're also going to be able to do even more tests than what we've been able to before. The Sweetwater County COVID-19 Emergency Operations Center announced today that they're going to expand local testing efforts for COVID-19. As we've said, the Wyoming Department of Health had previously, at the start of this month, put in place some testing restrictions and limited tests to high priority patients that fell into a few different categories. And so patients who didn't meet those requirements or fall into those categories couldn't have their tests done through the state lab. At the governor's last press conference last Thursday, as I said, Dr. Alexia Harris announced that they're going to be able to expand their testing. They have more resources now and will be able to accept tests from other patients that aren't just the high priority patients. And this is good news for us in Sweetwater County too, because as the state's testing capacity expands, ours is expanding as well. We're getting more resources and more things we need to be able to do more tests. Our Sweetwater County Public Health Director, Kim Weinberger, explained that part of what goes into the testing resources and limits is not just the tests themselves, but being able to transport those tests to get results. She said there are two critical components to testing for the COVID-19 virus: nasal swabs and transport media. Transport media is a medical term for the chemical solution needed to store collected specimens and transport them to the lab for testing. County Health Officer Dr. Jean Station said, "When we encountered our first documented positive cases here in Wyoming, there was a nationwide shortage of transport media. In coordination with state health officials, County Public Health now has a healthy supply of testing materials, including transport media, which we have distributed to Sweetwater Memorial and Castle Rock. So because we have more of the resources we need, we'll be able to do even more tests." Dr. Station said, "As long as a state test kit is used, it is now possible for anyone who is feeling ill, not just those with a fever, cough, or shortness of breath, to consult their primary care provider, who can then order a diagnostic test at no cost to the patient in order to determine whether they are suffering from COVID." So because we have more resources, we're not limited to the high priority categories and just people with certain symptoms. So now there's more openness for people who want to test, who are worried that they might have COVID or who haven't been feeling well. They can go get those tests. County health authorities also found out over the weekend that antibody testing is now available through ARUP Laboratories, which has a medical lab in Salt Lake City. There's a slight difference between diagnostic tests and the antibody tests. Diagnostic tests are testing those who are infected or might be infected with the disease, and antibody tests are used to identify who has already been infected by it. And scientists and doctors are trying to use more antibody tests to learn more about the disease, how it works, how it affects our bodies, and excuse me, they're using those tests to see who's maybe been exposed, whether or not they had symptoms, and trying to figure out if once you have the disease, if you become immune to it. They said it remains unclear among the medical community at large if those who test positive for the antibody may be immune from reinfection or how long any possible immunity might last, if at all. So they're not sure yet about the immunity or how the antibodies respond to the virus, but as they're able to do more testing with that, they'll be able to find more answers. Lineberger noted that testing is a tool, that no test is perfect, but the availability of both diagnostic and antibody testing is an important piece in beginning to understand the true prevalence and spread of this disease in our community. Lineberger also said, while there is a minimal cost associated with these antibody tests, we encourage anyone who is interested in getting tested for COVID-19 antibodies to consult their primary care provider. So we were excited to hear that news, that the testing is expanding, that we have more options now, and hopefully that will help our health professionals continue to learn more and know how to respond to this disease. Today, Western Wyoming Community College also shared a story with us, and they were sharing some of how they've been adapting to COVID-19, and they've had innovative new teaching styles, and they're using online classes and distance learning because obviously the campus is shut down now. So all of their classes were transferred online, but they've been finding really unique and creative ways to make those classes possible, especially for people whose classes usually require more in-person, hands-on sort of activities. The story shared specifically about the dance, nursing, and biology teachers and classes and some of the resources that they've found and things that they've been using. They've been using recorded videos and Zoom calls. The nursing department has virtual simulations that students can do. So it was really exciting and cool to see and hear about how they're adjusting those classes so that students can keep learning, even things that we usually would think you would have to be there in person. They're finding new ways to make that possible while we social distance right now. They noted the migration of in-person courses to a virtual delivery would not have been possible without the staff in Western's Center for Teaching, Learning, and Innovation and the Information and Technology Department. So shout outs to those departments for all of the hard work that they've been doing to make this possible. And definitely encourage you to go read that story at rocketminer.com because it's really cool to hear about the different things that they've come up with to be able to continue doing their classes. So you know, tomorrow Governor Mark Gordon is going to hold a media briefing at 4 p.m. They said the governor will be joined by State Health Officer Dr. Alexia Harris to provide an update on the public health orders set to expire April 30th and to take questions from the media on Wyoming's ongoing response to the COVID-19 pandemic. So if you want to watch the newest, most recent update from the governor on where our plans are at, what we're looking at for the next month, and to answer the questions that the media will have for him, that briefing is going to be live streamed on Wyoming PBS television, as well as the Wyoming PBS Facebook and YouTube pages, so you can watch it there. Today, as I was looking at the news and thinking through these stories, it just occurred to me how thankful I am for the technology that we have. And this has occurred to me a lot over the past month, but I just think it's so interesting that when you look at history, pandemics like this aren't really a new thing. Obviously, this is a new disease, but history has gone through multiple things like this before. And as I mentioned in one of my recent videos, you think about the Spanish flu pandemic in 1918 and looking at how people responded to that in similar ways to what we're doing now. But it occurred to me that we are so privileged to be going through this right now while we're in the age of technology. I can only imagine what it was like for them in 1918 when the technology was still so restricted. They couldn't do Zoom calls and they couldn't do online classes or online shopping. It was such a different world then, and I just think it's awesome that we are so privileged to live in this world and in this age of technology where we can still connect with each other. We can still hear from our governor on a YouTube live stream, and he can update us continually about their plans and what they're doing. We can still have classes that are being learned online in ways that never would have been possible in the past. And especially that we can have this technology just to connect and stay in touch with each other and to encourage and help each other through this time. So that's just one of the positives to keep reminding ourselves of, is that we have a lot of resources and we can take advantage of those, and I am thankful for all of the opportunities that they give us. So thank you for listening. Please keep checking in with us for more updates, and I hope you have a good evening.